This is Professor Grodman's review for Chapter 1 in Psych 111. We are going to focus on some basic definitions and also some historical influences in psychology. Also talk a bit about the subfields of psychology and a bit about research methods. Psychology is the study of the mind and behavior. Freud is obviously a very big fixture in psychology, although ironically not a psychologist, a neurologist. He is the pioneer of psychoanalysis, a type of treatment aimed at looking at the unconscious and things we're not aware of, these sort of conflicts, sexual and aggressive, which influence behavior. He also develops a paradigm to explain personality development, which we will focus on later on in the semester. Freud became prominent in the late 19th and early 20th centuries. One of the criticisms of Freudian theory was it was not empirical, it could not be proven or disproven. Behaviorists, or the school of behaviorism, came about in the early 20th century, shortly after Freud, to focus on the environment and those influences, those nurture influences, which can be seen and quantified. And there are many figures we're going to talk about who fall into this area. Certainly John Watson, pioneer of behaviorism. An aspect or an offshoot of behaviorism, actually in some ways a foundation, was Pavlov's model of classical conditioning, learning based on pairings or associations. If you crave popcorn in a movie theater and you've made that association, that is a connection, a real-life example to classical conditioning. B.F. Skinner was a 20th century American psychologist who looked at consequences of behavior. And if we are rewarded, we do something more. We're positively reinforced. If we're punished, the consequence is it will reduce behavior. All of this falls under the heading of Skinner's operant or instrumental conditioning model. Carl Rogers was another prominent 20th century but post-World War II American psychologist who looked at positive regard, that we need to be affirmed, loved, cared for, and those affirmations can be unconditional, whereby you have someone or persons in your life, usually one or two, who are unconditionally regarding of you. But sometimes you may not have that. You may have situations that are contingent upon your behaving in a certain manner to be regarded. And this is referred to as conditional positive regard. Not as desirable as unconditional, but according to Rogers, it certainly gives you affirmation that you need. Rogers and a person by the name of Abraham Maslow, who came around the 1950s, are considered humanistic theorists or humanistic psychologists. Abraham Maslow developed the very well-known hierarchy of needs model that looks at extrinsic influences. For example, if you don't have food on your plate or a roof over your head, that's what's going to motivate you. The basic foundational levels, level 1 being your physiological needs, level 2 your safety needs. Then once these needs are met, you can consider intangibles, such as level 3, love and belonging, level 4, achievement, and level 5, something called self-actualization, which most people don't achieve. Self-actualization is tied in and synonymous with self-fulfillment. Doing things, expressing yourself in such a way that it is truly internally fulfilling and usually not monetarily motivated. It is also characteristic, if you are self-actualized, of a person who has a good sense of identity, knows who they are, again, this sort of self-awareness, and has relationships, but only a finite number of relationships, which are, though, deep and substantive. So these are some of the characteristics of a self-actualized person. There are many subfields of psychology, just switching gears for a minute and moving on from some of the key players historically. The most common subfield of psychology is clinical, where people are trained to do testing, IQ testing and personality testing, along with psychotherapy. Clinical psychologists also have research training. Industrial organizational psychologists work in business settings and work on increasing worker productivity. Oftentimes there's a relationship between worker productivity and worker satisfaction. Highly satisfied workers tend to be productive. Developmental psychologists look at different stages of development of the lifespan, such as infancy or early childhood, adolescence, and so on. Research is a key component of all areas of psychology, and there are many things that are studied and many research methods. The most common research method used in psychology or employed is the survey method, in which attitudes are polled or surveyed, like questionnaire research. And you might be asked a question or questions pertaining to a theme, such as your belief or attitudes toward psychology or mental health professionals or the mental health fields or approaches. And those responses are often correlated or evaluated in relation to your demographic makeup, age, ethnicity, educational level, and so on. And for example, highly educated people tend to at least report being, I don't know if they really are, but they tend to report being more open to mental health treatment such as psychotherapy. That would be an example of something that has been developed from survey research. Interestingly, in psychology, you would think that individual cases would be studied a lot. From a research perspective, this is not the case. From a clinical one, it is common that people certainly are the focus of clinical discussion, but from a research perspective, it is usually not the case that one individual case is the focus, either animal or human subject, because it tends to be not a lot of information or data is gathered that is new or is going to contribute to the literature from one individual subject. Now, if you have something very atypical, that may not be the case, such as, I think I gave this example in class, a serial killer. Now, that would be worth studying because that's much more atypical. I might have quickly run by or not even mentioned one other method of research, and this is the last piece of information or area we're going to focus on in Chapter 1, and that is experimental research, also referred to as scientific research. This is what is often associated with research in that there is a causal relationship. Cause and effect is looked at. The effects of caffeine on behavior, the effects of smoking on behavior in some manner, exercise and its effect on depression or anxiety, or reading and its effect on psychiatric symptomatology. These are one group would get any of these conditions. One group does not get them. And looking at those influences, this is inherent or and associated with the experimental, also referred to as the scientific method. With all areas of research in psychology and probably other fields as well, a literature search is done. You review the existing literature with the hopes of not just replicating what's been done before, but adding something new to the literature. And if you're going to experiment with a population, you may not need every single person to be tested or part of participating. So, for example, if you had 10,000 subjects who were depressed, and most of those people would give their consent to participate, you wouldn't necessarily need to test all those people. It may not be practical. So you might randomly select a small number from a much larger number. This is called random selection. And then ultimately put them into two groups. Either a control group, in a drug study, for example, getting a placebo or sugar pill, or the experimental group getting what's known as the independent variable, the treatment variable, or the treatment variable, or what's being studied, such as a drug like Prozac or some antidepressant. Ultimately, the two groups are allowed. There is the administration of the drug or the placebo. We're talking about a drug study now. I think those drug studies clearly illustrate these terms, these constructs. And after some period of time, the groups are evaluated. By the way, the technicians, as noted also in class, are not aware of who's getting the drug or not, or who's getting the placebo or not, because that sort of information might bias them and give out, even unconsciously or subconsciously, information to the subject. So they don't know who's getting it, the technicians. People at another level in the experiment would know, but they wouldn't have direct contact with the subjects. Eventually, after some time has passed, the groups would be compared. The experimental and control groups would be compared. Usually, if we're talking about an antidepressant study, it would be based on some metric or measure of depression. This is called the dependent variable or dependent measure. And it might be, as noted in class, as simple as a checklist of depressive symptoms: hopelessness, helplessness, suicidal thinking, changes in in eating or sleeping habits, classic symptoms of depression. Let's say 10 of them. And then the groups are statistically compared. Now, if their scores are the same, the higher the number, the more depression you have, the hypothesis that the drug is going to work, or the contention or argument, the hypothesis, is not supported. If there is a difference, and the control group has much more depression than the experimental group getting the independent variable, or the antidepressant in this case, your hypothesis has been supported, and the statistical evidence supports it. And you'd probably replicate this study over and over again. This is called a meta-analysis. Ultimately, people participating in drug studies especially are typically asked questions after the study in terms of their experiences. This is called debriefing. This occurs in other studies as well, not even involving drugs. But especially if there is a drug that has not been approved, such as an antidepressant by the Food and Drug Administration, it is the responsibility, the ethical responsibility of the researchers / investigators to make sure that all the parties, not even just the experimental group folks, but the control group folks who are also depressed getting the placebo, that they are referred for appropriate services. So this is the debriefing process. By the way, the entire process also requires that every single subject gives their consent and is informed as to what the study is about. And then also a review board, before anything has happened, has given the approval for the study to run, because that's a very important and critical role. The review board has to determine if the benefits of the research far outweigh the costs. And that is something that is sort of a prerequisite of any research study being conducted in this day and age. So that is a review of the relevant terms for Chapter 1 in your text. I will be doing additional YouTube audios of the chapters, certainly the reviews. I think those are already online, but more to come in terms of the chapters, which I think is hopefully will be a nice supplement to your class, and a very quick synthesis of a much more extended discussion and lecture. So, okay, hopefully you've enjoyed this and have been able to follow the concepts as outlined on Blackboard. Take care.